75% of the images found in widely used medical literature in the U.S. showcased lighter skin tones, with fewer than 5% featuring darker skin. Even in South Africa, which has a majority Black population, most medical students learn from similarly biased textbooks. And there is no doubt that these biases harm people. In the U.S., for instance, patients from racial and ethnic minority backgrounds are more likely than white people to have common skin conditions, such as psoriasis, go undiagnosed. The problem of racial bias in medicine is not restricted to dermatology either. Plenty of studies have found evidence of implicit or unconscious bias among healthcare professionals more broadly. This isn't surprising. Healthcare workers are human beings, and all of us have biases. But left unchecked, harmful stereotypes, such as the belief that Black people feel less pain than white people, can result in physicians underestimating the severity of symptoms in Black patients and failing to recommend appropriate treatment. Many of these stereotypes stem from the false belief that there are biological differences between races. For instance, a 2016 U.S. study of 222 white medical students and residents found that about half of them endorsed at least one of a list of false statements about biological differences between Black and white people, including Black people's nerve endings are less sensitive than white people's nerve endings, and Black people's skin has more collagen, i.e., it is thicker than white people's. The study found that these false beliefs predicted racial biases in the assessment of pain in fictional patients and in subsequent treatment recommendations. Race isn't a biological characteristic, but I can forgive anyone, including the medical students and residents in the study described earlier, for looking at our world and concluding otherwise. Across the globe, there are vast disparities between racial and ethnic groups when it comes to health. Belonging to a marginalized group is generally associated with poorer health outcomes. I became acutely aware of this as a science journalist reporting on racial and ethnic disparities in infections and deaths that emerged early on during the COVID-19 pandemic in many countries. Some scientists were quick to speculate that these disparities might be at least partly attributable to genetic differences between racial and ethnic groups. This reflects a long-standing trend within medical science of leaning on biology and genetics to try to explain racial and ethnic differences in health outcomes, rather than fully acknowledging and exploring the role of racism itself. Racial bias in medicine represents just one example of the many different ways in which racism is harming our health. Indeed, a growing and undeniable body of evidence points toward racism within our societies as a major contributor to persistent racial and ethnic health gaps in today's world. Global scientific and medical authorities are increasingly recognizing racism as the dangerous public health threat that it is. In the years leading up to the publication of this book, the renowned medical journal The Lancet described racism as a public health emergency of global concern and published a special series showing how racism, xenophobia, discrimination, and the structures that support them are detrimental to health. In the same vein, the World Health Organization, WHO, acknowledged in a 2022 report that health inequities affecting populations experiencing racial discrimination are significant and remain pervasive across many countries, noting that these inequities are driven by interactions between the wider social determinants of health and structural racism and discrimination in society. In a 2020 interview with NPR, Louisiana Senator Bill Cassidy attributed the disproportionate impact of COVID-19 on the state's Black population to the fact that African Americans are 60% more likely to have diabetes, without acknowledging how racism contributes to that underlying health disparity. Responding to the suggestion that such health disparities were rooted in years of systemic racism, Cassidy, who is also a doctor, said,